Good evening, everyone. My name is Tyler Granger. I'm a member of the University Hospital's Marketing and Communications team. I will be the moderator for our event tonight. On behalf of University Hospital's family, thank you for joining us for our webinar on non-healing wound and treatment options. A couple of housekeeping notes before we begin. In this platform, all attendees are muted. While you won't be able to ask questions through your microphone, please note the Q&A functions at the bottom of your screen. If you have a question that is not addressed in the presentation, please submit your questions through the Q&A feature and our presenter will address the questions at the end of the presentation. Also, this evening's webinar is being recorded and will be available for viewing on demand in the near future. It will be posted on our website, and as an attendee of today's session, you will receive an email with that link. Finally, please take a moment to respond to our brief survey after tonight's event. It is now my pleasure to introduce our presenters for tonight. Dr. Lemming Yu is a clinical assistant professor at Case Western Reserve University School of Medicine, board certified in surgery. He is most recently appointed the medical director of the newly opened Wound and Hyperbaric Center at UH Medical Center. His special interests include laparoscopic surgery, gallbladder, common bile duct, anti-reflux surgery, hiatal hernias, small and large intestine, hernias including abdominal wall reconstruction, plus endoscopy, EGD, and colonoscopy. Our second presenter is Beth Pakowski. She is the program director for the newly opened Wound and Hyperbaric Center at UH Medical Center in Chardon, Ohio. Beth has been with UH for 19 years and in 2019, she joined the Hillogics team to run the Wound Center at UH. Ladies and gentlemen, Dr. Lemming Yu and Beth Pakowski.
Good evening, everyone. So today's topic is non-healing wound care and the treatment options. Hey, Tyler, could you advance the slide for me? So as Tyler said, I'm a general surgeon, and I'm also a wound specialist and medical director for our wound center and hyperbaric medicine center. And Beth is with me today, and she's a program director. She is the key into our success of the wound center, and she actually runs daily operations of the wound center. And if in the end, if you have any questions about how the wound center operates, and please ask questions to Beth, and she would be happy to answer all your questions. And the next slide, please. So the objectives of today's presentation is to help you understand the basic anatomy functions of the skin and understand common causes of the wound, and help you to understand the normal wound healing process and know when to seek medical help. Help you to understand what are the advanced wound care available and the treatment options. Next one. So in the beginning, I'm gonna talk briefly about basic skin anatomy and the functions. And as you can see, and the skin has actually has 3 layers, and the outermost is the epidermis, and below that is the dermis, and then the third one is subcutaneous tissue, and also it's called hypodermis. As you can see, and the skin actually is it's fed by and small vessels, as you can see, and also it has the nerve innervated into it, and so also has the skin has other appendages, and including the sweat gland, which helps with mainly with the body temperature regulation, and also it helps with the control and the balance of the fluid electrolytes. The other one, as you can see, this is a hair follicle, and, attached to that is it's called a sebaceous cyst. Sebaceous gland, and actually, this is a gland that will secrete lubricants and then to lubricate the skin. Um, uh, if you guys heard about the sebaceous cyst, and that is because of the opening of the gland, it gets blocked, and so it's has a abnormal cyst formation that can be treated surgically. And since I'm a general surgery, have I deal with this kind of condition quite often. So the skin is the largest organ of the body, and it offers the protection to pathogens, and including bacteria, virus, and also UV lights, chemical and mechanical injuries. Like what I said before, it helps to regulate the body temperature, and it's involved in the sensation and communication. And actually, we can imagine, the skin on your face, and actually has it's very critical and for personal individual identification. And so again, the skin helps with the fluid and electrolytes balance, and it involves in the metabolism as well. And um, we all know that actually the vitamin D and is and made and in by the skin, and and that can help with your bone metabolism as well. Next. Next one. So when the injury and that breaks the skin, and then at that point the wound happens, and this examples of the wounds. And next. So what's the common causes for the wounds? And so these are a list, and for the the common causes of the wounds. Um, One is a mechanical injury, and most of the time is from the surgery or trauma. Um, the second one is moisture and the chemical irritant, and that includes the urine and the feces, and that can destroy or damage the natural barrier of the skin, and the wound can happen. Um, Unfortunately, in some medical devices and adhesives, and they can cause damage to the skin, and with it's not uncommon, and patient actually can develop the wound, and after the adhesive application. The other one is unrelieved pressure, so commonly called a bed sore. And when the patient is debilitated and they lie on the bed, and then with persistent pressure, and the skin can break and the wound can happen. Vascular compromise, and that is including the arterial and the venous aspect. The other one is infection, and bacteria and the viral infection. Um, then the allergic reaction, and can cause either dermatitis, and the severe one, and then they can cause a blister, and also the skin breakdown, and to form a open wound. Radiation therapy, and radiation has been used for cancer treatment, and high dose radiation actually can cause injury to the skin, and can cause wound as well. The next. So when when we have a wound, and our body will try to heal that wound. And the normal wound healing actually follows a orderly pathway, and it has four phases, and including the hemostasis. Basically, what happened is when you have a open wound, and then the body will try to stop the bleeding, and during that process, a bunch of cells and the clotting factors and will be involved, and to form the fibrin plaque to stop the bleeding and the blood clot as well. During the process, and the growth factors can be released, and then it transition to the second stage, and which is called inflammation. During this phase, inflammatory cells, including lymphocells and lymphocytes and macrophages, and basically will be involved, and then they try to clear the non-viable dead tissue, and also in order to get rid of the bacterial pathogens, and so clean up the wound, and so the wound can the healing can be transitioned to the next phase, and which is called the proliferation. At this phase, lot of important cells are involved as well, including the fibroblast cells, and um, the body is trying to make it's called the extracellular matrix, and which includes the collagen, and also the new, it's called the new angiogenesis, basically the formation of the small new vessels, and to fill this wound bed. And during the same time, the epithelial cells and they try to migrate and towards the wound, and cover the wound, and so um, um, then the last stage is called the remodeling. Basically, at that point, and the scar is formed, and the body is trying to remodel the scar, and then they try to obtain as much of the normal tissue strength, and then they contract um, uh, uh, contraction and make the wound smaller. Um, so as a surgeon, and I can always tell the patient, and when you have a wound, and even they are completely closed and healed, and they normally they will not be able to reach the normal strength of the before the injury, and most of the time they can only reach about 80% of the normal strength. Um, so when the wound does not heal in a expected way, and follow this orderly pathway, and it doesn't heal in a predictable amount of time, and then a chronic wound and happens. Um, when the wound becomes chronic, and a lot of time, and the intensive medical intervention and wound treatment are required to basically to make this wound to go into this normal healing pathway again. Next one, please. So these are several common types of chronic wounds, and one is called a venous stasis ulcer, and this is a venous ulcer. What happened is when the patient's venous system is compromised, and the blood flow and can is compromised, and patient will have edema and have thickening of the skin, the wound and the wound doesn't heal, and if the patient has a open wound that due to a lot of time is because of the trauma. um, so this is a venous wound, I mean ulcer. The other one is arterial ulcer, and basically what happened is because of the perfusion got compromised, and due to arterial problems, blockage, and um, this is a an example of the diabetic foot ulcer, and as you can tell, because of the the patient with diabetes, they one is they tend to have compromised circulation, and the two is they don't have they have neuropathy. Basically, they don't have a normal sensation, and when they have even when they have a wound or also of they don't feel that, and for the trauma, some patient that they the foot gets injured due to the heater and during the winter, and because they have a decreased sensation, and they don't realize the injury, and actually the wound can be really bad. The other one is a pressure ulcer, and this is a pressure ulcer at the decubitus, I mean sacral region, and that because of the patient lie in the bed for too long, and then the skin it gets injured, and then result in a open wound. Some surgical wound, and then traumatic wound, and basically is from the surgery and the trauma. The next one. So the a chronic wound actually can have a significant impact and adversely, and then the impact on the individual and the society. It's reported that about 1 to 2% of the population in the developed country actually suffer from a chronic wound in the lifetime. In the state, it affects about 6.5 million patients. The incidence is expected to increase, and because of the population is aging. The So again, it can have significant impact on the health and the quality of life of the patient and the family who take care of the patient. The chronic wound can have chronic pain, and they can cause loss of function and the mobility because because of the pain, and the patient they and sometimes they don't ambulate or more um, function well. um, they because of the chronic wound, they have decreased the social I mean increased the social stress and the isolation, and there was an open wound, and they the, they sometimes they feel embarrassed and to go and to social with people, and it can cause depression and anxiety. um, the chronic wound actually, and it's reported that will prolong the hospital stays and increased financial burden, and overall it will increase patients mobility and the mortality, and that's the 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 financial burden, and from the chronic wound on society is substantial too, and more than 25 billion actually is spent on treating wound related complications every year in the states. um, the for comparison, and in 2016, about 42 billion and uh, dollars was spent for the cancer drug development. So, and that is, I mean, 25 billion actually is a large amount of the dollars spent for the wound patient. The next one. The common causes for the chronic wounds and include the following. And one is like what I mentioned before, actually, is compromised perfusion and oxygenation, and because of the vascular disease, and also presence of the dead tissue, and um, from the injury or infection stuff, and um, the other one is a persistent infection, the persistent injury from the pressure, and if we are not careful about uh, uh, about the pressure relief and for the bed bound patient, and by turning them frequently, and some wheelchair bound patient, and because they sit and in the wheelchair, and they can cause the persistent, I mean, the chronic wound in the body as well. Edema, and um, a significant moisture, and from like urine or fecal spillage, and especially for those debilitated patient and also paraplegic patient. Um, the underlying conditions, and including the poor nutrition, smoking, and some medications, actually they can affect the wound healing and adversely, and including the steroids and the chemotherapy, chemo drug. The cardiac, the heart and the lung condition, and then because this actually can cause, one is the problem with oxygenation, and the two is a cardiac, I mean heart problem. They can cause edema for the lower extremities, kidney function, and again, and the patient with impaired kidney function, they tend to have uh, edema of the lower extremity, and then that is a common cause for the chronic wound as well. Radiation and the cancer, and um, for the cancer, and if the sometimes the patient that they actually a couple patients, and already, and they came to see me, and they think they have a wound, but in the end, actually, and it's the cancer, and when the cancer is there, and the wound is not gonna heal. So during our daily, practice, and in our wound center, we follow this algorithm, and it's very small, but basically, 9 essential steps, and for the wound healing, and we follow this algorithm, and basically try to address all these, reasons why the wound is not healing. The next one. In our center, we also offer advanced wound care, and basically that includes a debridement, and that means we're gonna use the surgical instrument, and to remove the dead tissue to promote healing. This actually is very important, and because the dead tissue and serve as a very good medium and for the bacteria, and they can it, get the wound infected, and if we don't remove the dead tissue, and also the dead tissue can release toxins into the wound, and which can um, um, inhibit the wound healing. And so the other one is we offer advice, and how to uh, do the pressure offloading, especially for the foot wound, diabetic foot wound, and also the pressure wound. And we do have two podiatrists in our center, and they design, and I mean they kind of like try to individualize the patient's shoes, and try to offload the pressure and to help with the wound healing. The other one is a way of wound culture, and basically, um, if we suspect that the wound is infected, and the wound culture will help us to identify, one is what kind of like pathogens involved, two is what kind of the antibiotics will be used to target those bacteria, pathogens. We offer compression therapy, which includes the wound boots as well, and try to reduce the edema. We also have wound vac, and basically that is a another advanced treatment, and to promote the wound healing and control the actual day drainage, and also will help to protect the surrounding and the skin as well. We offer we have the skin substitutes, and also the growth factors, which are important for the wound healing as well. And lastly, we have hyperbaric oxygen and treatment in our center, and actually it is the only one in Geauga County at this point. What the next one? What the hyperbaric oxygen therapy is basically this is the hyperbaric oxygen therapy chamber, and the patient that goes into this chamber, and they breathe 100% oxygen, and in the chamber the pressure is increased. So basically, that will help the oxygen to be dissolved in the circulation more, and then it basically provide more fuels for the tissue to heal. And what the patient lies in this chamber, and actually, as you can see, this is a TV monitor, and what you can do, actually, you can just if you like, and you can watch TV and movies when you get treatment. Normally, the session lasts about 90 to 120 minutes, and normally we recommend it's a daily treatment for 5 days a week, and depends on the wound and the indication, and it takes about 60 to 40 to 60 treatment, and that depends. This is the conditions, and can be treated, and with hyperbaric oxygen therapy, and the majority of time is diabetic wound of the lower extremity. We have been treating crush injury as well, and the chronic refractory osteomyelitis. The next one. So this is the mechanism, and the how through which hyperbaric oxygen treatment to heal the wound, and primarily is like what I said, and it's because it under the pressure, and the oxygen can be dissolved more in the circulation, so it increases the level of the oxygen, and apparently oxygen is the fuel for the cells to heal. And secondly, and the hyperbaric oxygen actually, and this can cause vasoconstriction. That means the vessel, and they can constrict, and that actually will help with the edema of the the limb. and it helps with the functioning of the white blood cells, and it's involved in the cleaning of the bacteria as well. So basically, multiple mechanisms and for the hyperbaric oxygen therapy. Um, uh, but this actually is, for the muscle reduction, and basically it's mainly used for the decompression and sickness. I'm not gonna get into that. The next one. So when to seek the advanced wound care, and the wound has failed to show significant progress in 4 weeks of standard care. Um, that is normally we recommend, but I highly and strongly actually encourage patient to seek care and as early as possible. And the saying is it's called time is tissue, and I mean, especially most patient and actually they don't know what is the standard care, right? So and even some other specialties and the physicians because they are not specialized, and um, so again, I would encourage patients to come and seek specialized wound care and as early as possible. Just for example, and I saw several patients, and they have a leg edema because of the heart problems or kidney problems or venous issues, and sometimes lymphedema. And they bumped into a chair or cabinet, and they have an open wound, and a lot of time, and they treat those wounds just with topical antibiotics and a bandage, and actually often, and I noticed there's some still that skin or that tissue in the wound, and if you don't remove and those non-viable tissues and the skin, and the wound is not gonna heal, and actually that will cause later and the infection, and the wound will look really bad. And the other one is the wound involves the deep tissue and structure of the, and that's lymph or life threatening, and basically it's it's bad, and then in injury and a wound. You have significant comorbidities, and the wound is complicated by that, and including the vascular disease and persistent swelling, basically edema, and the infection doesn't go away, and has a prior radiation treatment and of the area and where the wound is, and because of the radiation, and a lot of time, and the tissue perfusion is significantly affected, and a lot of time those wounds will not be able to heal without intensive intervention. I mean significant intervention. You have a compromised immune system, and your cancer patient is getting chemotherapy, and that you have other um, disorders of the immune system. The next one. But the good news is we do have a state-of-the-art facility, and be there and to help you. So if you have any questions, just call, and we'll be happy to take care of you. And this is part of our team, and this is Beth. And again, she is the key to uh, our success. So thank you.
Thank you, Dr. Yu. At this time, we will take a few questions from the audience. If you have any questions, please feel free to submit those through the Q&A function. In the meantime, we did receive a couple questions beforehand. So Beth, if you'd like to ask those a couple of those questions.
Let me get those questions. Tyler, I did not receive that email.
That's okay. Let me read. I'll read them off.
Okay, perfect.
So the first one, this patient is suffering from dementia and has a small had a small cancer mole removed on their forehead, and that patient had kept picking at it, and it's now a larger 5-centimeter hole in the forehead. It's an older patient, and they are trying to figure out how they can help their family member with this wound on their forehead. Any advice that you could give, Dr. Yu?
I mean, the first thing I was thinking is, you know, like what I mentioned before, and when you have a long, you know, healing wound, actually the common cause, and I mean, one of the common causes is cancer, and he did have a history of is it cancer or just the mole removal?
They said they had a skin cancer mole removed.
Oh, okay. And so hopefully, you know, and it's not a recurrence of cancer, and then that's the first thing, and probably should be ruled out. And because if it's cancer coming back and the wound is not gonna heal. The second is the wound actually is it's pretty, you know, sizable. It's a 5 centimeter and in size. If I okay, and so a lot of time, and you know, you can try to see whether, you know, we can heal with standard of care, and sometimes may not be enough, and the patient may even need skin graft, and then so the surgically. The other thing is, you know, I understand that the patient you know, has dementia, but and the elderly patient, but I think they still you know, deserve a adequate care and to heal the wound. And if the patient picks up on the wound, and you know, and I'm sure it's not by purpose, and so what we can sometimes do is maybe wrap the area, and you know, and hopefully the wound is not got disturbed, you know, repetitively, and to heal that wound. But I think the first step at this point probably is, you know, try to make sure it's not cancer coming back.
All right, thank you.
Mm-hmm.
The next
And
question.
by the way, and as a general surgeon, I you know, take care of those patients as well. So.
Right. The next
Tyler,
question. Yeah, go ahead.
we have a question that came in from the Q&A.
Okay.
The question, Dr. Yu, is the only thing that helps my pressure wound is Coactive Plus. And Coactive Plus is a collagen matrix dressing. However, it eventually comes back.
I'm sorry, say that the last one. It's collagen-based, you know, dressing.
The dressing they refer to is Coactive Plus.
Yep.
And Coactive Plus is a collagen matrix dressing.
Yep.
They state, however, it eventually comes back.
And which you mean the wound comes back?
Yes.
Okay, and so it's a pressure ulcer, you said?
Yes.
Okay, and so again, and so and it's very important, and if it's a pressure ulcer, and unfortunately, it needs to be very, cautious about, the pressure relief and the avoidance, and so I I I would say, that is the first thing, and you probably should do. And if the collagen-based, dressing and based dressing and helped before, and as long as the other condition didn't change, such as infection, and make sure the patient's nutritional status is good, and I mean, you can continue and to do that, and but that depends on whether the wound has a drainage or not, and sometimes the dressing would be different. Um, so that is, I would say, it's better and to see in person, and and make sure the wound doesn't have dead tissue or non-viable tissue. And if you can um, tell me more about the location of the wound, and that may help. And sometimes even for the a lot of time, and for the pressure also, and if it's a deep enough, and they can involve the muscle or fascia or even bone, and those needs to be addressed as well. So, but for the again, for the pressure also, the first thing I would do is suggest to if the patient can be turned, and turn the patient. If the patient sits in a wheelchair all the time, I would say avoid doing that. And if the pressure also on the foot, and I would say probably just get some offloading, and then shoes, and then that would be the first step.
Thank you, Dr. Yu.
No
I
problem.
have no other questions at this time, Tyler.
Okay, we did receive a more complicated question ahead of time. This patient was treated with abdominal radiation and installation of P32 in 1981 for peritoneal mesothelioma. After multiple surgeries and countless bowel obstructions, they have an ileostomy. The wound issues also involve multiple bladder fistulas, and they suffer from frequent bowel obstructions and UTIs from E. coli. Is there hope because they are not a surgical candidate?
Um, yeah, it is a very, complex situation, and because of the multiple surgeries, and because of a history of radiation, for the uh, I will have to, I don't know, whether the question is directed to the overall treatment, or the just hyperbaric oxygen and then treatment. If it's just for the hyperbaric oxygen treatment, and if the patient has radiation induced, I mean, because she does have or he has a history of radiation, and they can cause radiation induced cystitis, and that actually hyperbaric oxygen, and is indicated for that. But overall, and it's a very complex situation, and including the fistula as well, and a lot of time depends on the location of the fistula, and whether it's small bowel, whether it's colon, and whether it's high output, or whether it's low output, and given the history of radiation, and a lot of time, and then the fistula can, I mean, it's hard to to resolve, and sometimes the last option probably more surgery, but because of the complex history of the surgery, and that can be very, very challenging as well. Yeah.
All right, thank you, Dr. Yu. Those are all the questions we've received so far. So thank you, Dr. Yu and Beth, for your time and sharing this information and answering these great questions we received. A couple of reminders for the audience. We will be emailing you a link to view this session on our website soon. To schedule an appointment with the Wound Center, call 440-901-6570 or visit uhhospitals.org to learn more about wound care at UH.
Tyler,
yeah.
The direct phone number to the clinic is 440-214-3150. The other number will work if the call center, but a direct number is 440-214-3150.
Thank you, Beth.
And I want to, add one thing, and Beth, to we will try to, get patient in and as soon as possible, right? And Beth, can you, explain how that works? And
Yeah, our goal is to accommodate the patient 24 to 48 hours after the referral or the patient calls. So you don't need a referral if your insurance doesn't require that you need a referral for a specialist. So if you don't need that, you can call directly. You don't need a referral from your doctor. Also, if you're receiving home care, you can still come to the wound clinic as well. So in many cases, we do partner with people who have home care nurses that take care of their wounds, and we will help you move in the right direction and change maybe therapies by coming in and partnering with home care as well. But our goal is to accommodate 24 to 48 hours, and our office hours are Monday through Friday from 8 to 4:30.
And also, I want to add, so this picture actually, is just part of our team, and we do have 2 general surgeons on the team, including me and Dr. Madden. She actually is right here, and on the team, and we have 2 podiatrists, on the team as well, and they mainly, treating patients and with foot wound and lower extremity wound. We have 2 nurse practitioners and actually on the team as well, and one is with the infectious disease service, and so we in addition to that, we work closely with other specialties, and including the primary care physicians and heart doctors, kidney doctors, and especially plastic surgeons as well. And so for the wound, and if they need skin graft and even flap, and we will get the plastic surgeons on board, and basically we take multi-disciplinary approach, and for the patient, and in the meantime we individualize the treatment for all the patients. So and we also work closely with the lymphedema clinic, so
yeah,
and the vascular surgery. So
yeah, we have a very vast multidisciplinary team, and if they're not in our clinic, we will help you get connected.
All right, thank you, Dr. Yu and Beth.
Thank you.
This concludes tonight's session. Thank you for attending, and we hope you join us for future webinars. Have a great evening, everyone.
Thank you.
Thank you.